There are quite a few differences in communications and the workplace that can lead to some miscommunication.
At the beginning, everything is new. You feel completely lost, and most of the people feel judged.
It's like going into a new hospital to do a locum job. Nothing is in the right place. You don't know who people are. You don't know who to ask. You don't know how to find the information you need. And then every encounter with a patient or a colleague is fraught with anxiety about communicating and misunderstanding.
The professional language and the language that they use to speak with patients, the language which is used amongst the colleagues, and the colloquial language is still something that I know that I'm not very confident at yet.
The greatest difference is patient safety, because when we do admission until discharge, we have this risk assessment. We have to check their diet, we have to check their nutrition, we have to check their BMI, we have to check the risk for falls. And in the Philippines, it's just like the basic necessities.
They've often come from cultures that are much more monocultural, and I think we're multicultural. And oddly, I think that is actually quite difficult for many of them, even more than just coming to a different culture, which is what they expect. Actually, what they're coming to is a melting pot.
Here you get to see like lots of different background, lots of different concepts, lots of values. So you have to deal each and every person differently, where back home you can just generalize everyone and just go with the flow.
Culture in our countries, we know the culture. We take some things for granted. We don't need to ask because we know. But if we extrapolate this to another country, another culture, it just doesn't work. Because especially London, there are people from almost everywhere in the world. And medicine is medicine everywhere. We have studied the same thing, the same diseases, but the way of interacting is completely different. And if we use the same for everybody, we are going to fail.
There's both your general culture, which you really pick up from your carers before you can talk, really, in terms of the things that are good and bad, how you relate to your seniors, what makes you feel better, what makes you feel worse. And that does vary in a very subtle way from culture to culture. And then on top of that, you've got 5 years of learning in medical school and picking up not just a hidden curriculum, but the implicit curriculum, the things that people take for granted but never quite explain to you.
When they're trying to tell you something, they often will try to tell it in sometimes oblique way. They're trying to soften it. And that in the continent comes across as not coming straight to the point and not saying what you think, and as in a way hiding your true intentions, and sometimes leading to a complete communications failure where one thinks, oh, that went pretty well, and actually the person was the entire time trying to say quite negative things, but in a very nice way.
Normally, people in my country, they expect the doctor to know everything, to have all the answers. They come to you, you have to sort out the problem. And if you hesitate or you try to ask them something else, or what do you think, and they will think like, why did you ask me? You are the doctor, you should know, come on.
For those who've trained outside of this country, it's quite difficult to adjust to some of our current thinking about trying to elicit patients' or parents' or families' concerns, and how really to organise their whole interview around that.
Here, the patient gives consent, but back in my country, for example, if it's a woman, the consent is either by parents, or by husband, or by brother. The other cultural difference I found very challenging is that we are taught directly, we are asked directly, we are questions just straightforward and directly. Can you do this, or would you do this, or please do this? But here everything goes indirectly, because in the British culture For example, I was standing with my consultant and she said, let's have a look at the abdominal x-ray. And I was just standing there until she opened the computer herself. And then I was so kind of, when you feel ashamed. And then I was like, okay, this is a difference in the culture that I need to be learning.
In Albania, you can't have that communication with a consultant. So, because, I don't know, it's still that hierarchy that as a junior doctor you can't, you just do actions, and then it's understood by the consultant that these are the actions that you are supposed to do. And then when you reach them, when you approach them, only probably in very, very, very serious or very important circumstances. But here, when you see them just talking to you, like creating that environment that it feels like they're your friends, but they're not your friends actually. So you have to respect the professional boundaries.
And even asking for clarification is something that they might actually find culturally quite difficult.
Our ethical codes are different, and that's often a challenge. And that's quite hard for them because they will have been brought up medically, as it were, in their training in a certain way. And when they come here, our ethical codes are quite different, and that's very fundamental. That goes back to the pyramid of culture. It's easy to change the top 5%, the way you look, the way you dress. That's what you expect people. You expect them to look different. You expect the buildings to be different, the clothes to be different, the language to be different. But actually, the deep held beliefs are much harder to change.
It made me realize certain things that are deeply held beliefs, cultural beliefs, that I wasn't even completely aware that I had.
Every culture has a different way of being a doctor, and our tendency is to say our way is best, and in fact all you can say is that our way is best for us here and now in the UK, and the way that you were trained was probably more appropriate for the work that you were doing in the setting and the culture where you were working.
I think it's absolutely terrifying, the thought of going to work somewhere where I don't understand the language. I've got to learn it first, learn it well enough even to be able to look after my family, do the shopping, see a doctor myself, let alone consult with patients and do a job. I think if we thought about that a bit more often, we might be a bit more empathic towards our colleagues.